I chose to have my action research project be surrounding cultural competence in child welfare, specifically in Fremont County, Colorado. So today I'm going to go over with you. I'm going to start with the Fremont County overview, and then we'll talk a little bit about why I really believed at that point cultural competence needed to be addressed within our agency. I'll move into the needs assessment and the implementation of addressing. I'm sure that all of you who were able to join us last October remember the addressing model, and that is truly what I felt just needed to be spread far and wide. And then we'll talk about the post-training survey and go over a little conclusion. So I am so privileged to be able to live in Fremont County. This is a picture of our beautiful Royal Gorge, the highest suspension bridge in the United States that we have here. But along with our beauty comes these demos. So our population is right around 47,800. You'll see we're not all that diverse here in Fremont County. 91% white, 13.5% Hispanic, 4% African American, and we have a 78.8% white non-Hispanic population, according to the Census Bureau. So looking at kind of taking that a step further and looking at the makeup of the families here in Fremont County, according to the 2020 Kids Count by the Children's Campaign, and those of you that know Kids Count well, they basically are able to utilize statistics from the previous year or even 2 years prior to the data. So in 2018, they found that the total population was 47.9. And at that point, the child population was 7,885. Of those kiddos, there were 2,013 under 5. And then we really looked at the out-of-home placement rate here. In Colorado, the way that this rate works is it's per 1,000 children. So in Colorado, our out-of-home placement rate was 8.5 in 2018. Really eye-opening here in Fremont County, we were actually at 22.6%. Free and reduced lunches, Colorado in 2019 was at 40.7%, and in Fremont County, we are at 57.3. So to really hit the nail on the head even further, showing our population that are struggling with really being impoverished here in Fremont County. In 2019, there were 4.2% children in Colorado receiving TANF, and in Fremont County, it was 9.1%. And then also our teen birth rate in 2018 was very high per 1,000. At Colorado rate was 13.7, and here in Fremont County, we were at 25.5%. So a little bit of background research and data, really thinking about the why behind choosing cultural competence. When I started my MPLD journey and when I applied for the program, my plan was actually to look at fatherhood engagement. Our state and our county are involved in a performance improvement plan. Fatherhood engagement is a big component of that. And so I was like, oh, 2 birds, 1 stone, I got this. I'm going to totally look at dads. But again, going back to that October kickoff, there was a moment that my mentor and we were on a break on her beautiful patio, and we just kind of looked at each other and we were like, no, this is totally what I need to look at. This is what I need to do. And so at that point in time, our county was actually in the midst of trying to work out a contract with a private entity to really look at cultural competence within Fremont County. We knew that there was some stuff lacking there. I myself, being employed there at that point for 12 years, I had never had a cultural competence training. And so we knew that it was important. We knew it was lacking. And so we really started talking that, staff doesn't have a good understanding of cultural competence. And looking at that addressing model, they probably would never really even imagine that many of these things are part of culture. So then in the data pool and being able to look at the research that was out there, I was able to find that cultural competence is one of 6 guiding principles that was identified by the Children's Bureau to improve outcomes for children and families. So again, even more of a reason to really look at this piece. So my PICO. The PICO really states that if caseworkers receive cultural competence training, that it will result in increased knowledge, practice, attitudes of the caseworkers regarding addressing and contribute to a measure of client satisfaction that assesses clients' perception of how well their values and beliefs are being addressed. So my methodology, first step was really to examine that county data. And then I conducted a survey of staff's cultural competence as well as clients' perceptions surrounding the cultural competence. The next step was conducting a needs assessment survey to determine staff needs and the practices that we had in place at that point, and then implementing that addressing model for staff through a training, which I was able to develop. And then after that, developing and conducting a feedback survey, obviously with lots of help from Sharon Lynn. So looking at kind of examining that county data, I looked at 13 cases. And the cases that I pulled were specific to the past 13 cases up to that point. This was in November of 2020 that had actually been filed, termination of parental rights had been filed. In my mind, I got in child welfare with the hopes of keeping families together. I still maintain that. And so in my mind, those 13 cases were worst results. So what could we do better is always the way that I like to look at these cases. So of those 13 cases, I looked at their red team framework. And the red team framework is the process that we go through when we get our first initial call into the department. So red team stands for review, evaluate, and decide. There's a group of staff members from different teams that sit down every single day and go through the red team to decide if a allegation meets kind of that state criteria that is established. And through that red team, we talk about strengths, we talk about challenges, we talk about safety concerns, and we're supposed to address culture. As we know, culture is what kind of makes up families, and sometimes it can actually impact if what we're actually receiving from the reporter is a safety concern. So looking at those red team frameworks, 6 of them only identified race and language as cultural factors. 2 of those out of the 6 were actually listed as Caucasian inaccurately when I did more digging in those cases. 7 of those cases identified at least one other identity characteristic. So this could be something like single mom, multi-generational household, something like that. And then there was one case that actually didn't have any identity characteristics listed under the cultural piece of the framework. So the next step was the client survey. So I disseminated 65 surveys to families that had open cases between the January and December of 2020. They were disseminated via email, and then our in-home caseworkers followed up on the email with those families just to remind them, hey, don't forget to turn that in. That would be really, really helpful for our practice moving forward. So the results, we had a response rate of 26%. So we got 17 of those surveys back. I was feeling pretty excited about that, honestly. I was just terrified that I wasn't going to get any surveys back. So of those 17 surveys, 36% had children placed out of the home, 29 had children returned to the home and they were still receiving services at the time of the survey. And 73%, a huge strength, identified that they were actually able to meet with their child's caregiver to discuss culture, the way that their family liked to do things. And that's what we consider an icebreaker. So when a child's placed out of the home, we try to have the provider, whether that be foster parent, kinship parent, and the birth family meet and discuss those things. So other results, 90% of the clients stated that they were asked about race and or ethnicity. It made sense to me because, again, what we really saw was our staff were defining culture as race and ethnicity. 80% identified that they were asked about their age. 50% stated they were asked about nationality, developmental disabilities, values, and beliefs. Only 30% were asked about socioeconomic status and sexual orientation. A big piece, 29% felt DHS respected their cultural values and beliefs, but even more important, 71% felt they did not feel respected. that 71% was a true indicator for me that there was a need for this training and a need for really this ARP moving forward. So the staff needs assessment. We have approximately 30 staff in the child welfare unit that this was given to. And we had a response rate of about, sorry, my response rate isn't on there, sorry. So there was 18 of them. I thought I had that percentage on there. So there was 18 that actually came back. 22% reported that they never asked about race, ethnicity, or gender. So that makes sense as to why we had 2 of those cases that I initially looked at identified inaccurately. I think there's a lot of guessing going on. 44% reported that they never asked about sexual orientation. Again, I think there's big assumptions going on in our work, something that needed to be addressed. 33% reported that they always ask about age, socioeconomic status, gender, and Indigenous membership. So felt pretty good about that ICWA piece. I think we're hitting that and making sure that we're doing our due diligence there, but definitely more work to be done in other areas. So staff needs assessment, some themes and takeaways. One of the quotes was that staff felt that it stated, "I'm not comfortable asking some questions. The family may feel that it's too intrusive and it isn't any of a government entity's business." And then there was kind of this overarching theme that there was a lack of diversity within our community. And so that is kind of a barrier to embracing diversity within the families we work with. So I was really hoping that this could be something that we talked about in the training, and it really ended up being that way. So the training, this was my first ever solo training. I was so nervous. The training was completed in a discussion style, and the primary focus was surrounding the addressing model. It truly turned out to be such a fun and engaging experience. Staff appeared really engaged and excited to move forward with this work. The training itself included a self-assessment that all of the staff, I gave them an opportunity to complete. I didn't ask them to actually share the results of that, but it was really hopefully more of a way to look on the inside of themselves. We went over the data that I just shared with all of you. And then we did the cultural iceberg, which was super fun. I used myself as kind of the guinea pig and put a picture of myself up and asked them to identify my culture. And there was some pretty interesting comments and discussion points surrounding that. And then we really moved into the addressing model. That was the main component of the training. And then we touched on intersectionality. Out of the 30 staff members that were trained, there was only 2 that had ever heard of intersectionality. So the objective of the training was to explain to the audience the importance of cultural competence within our practice. And then we really discussed, how do we implement this? So through the addressing model, just went through each and every component of that acronym and talked about, okay, how do we talk about age? How do we talk about disability? And then at the end, I tried to connect it to our mission statement and really tried to make that impactful. So a reminder, as most of you have heard this before, the addressing model was introduced to me by through the kickoff. It is the Dr. Pamela Hayes model. It's a tool to really understand clients' cultural influences. And that acronym specifically is age, developmental disability, disabilities that are acquired, religion, ethnicity, socioeconomic status, sexual orientation, Indigenous heritage, national origin, and gender. So here are some results before and after the training. So you'll see that there was some great gains in many of these areas. So it was, there was 83% of staff prior to the training felt that it was important or very important to address age, and after the training, 100%. Regarding addressing acquired disabilities, 78 before the training felt that it was important, 100% after. A huge growth was only 39% felt that it was important or very important to address religion and spiritual orientation of clients before the training, but after we had 87%. So that was huge gain. And that was one of those conversations that was really engaging in the training. I let the staff know, many of these things we're going to talk about, a lot of us may have grown up with the idea that we don't talk about these things in public. And so it made sense that some of them were hard to kind of address, but we really got in there and I felt like had some great discussions. So some more feedback and results. 57% felt that addressing ethnic and racial identities was important, and 95% after. 52 felt that it was important to address the socioeconomic status, and 91% after. We spent a lot of time around socioeconomic status talking about it's not just how much somebody makes, it's about their education level. It's about the way that they value education, the way that they value employment, all of those things. And then moving on, 48% felt that addressing sexual orientation of clients was important before the training, and 91% after. And then 52% felt that it was important to address gender, and 96% after. Sexual orientation and gender was a huge hot topic in the training. Many of us didn't feel like we were really prepared or have the education necessary to talk about some of these things with clients. And so you'll see in future slides that this was a big takeaway for us. So the qualitative feedback, I was so excited to read so many of these comments, but just to highlight a couple of them, somebody stated, it broadened my definition of what culture is. That's exactly what I was hoping to do through this training. And then another staff member shared that it helped me to become aware of my own biases and ignorances towards culture and families. So that was really impactful to me. And that really helped me to believe that we did the right thing for the right reason, making this part of my ARP. So my hope that we will continue to use the addressing model and that it will continue to impact practice. Moving forward, my hope is that every time we receive a referral into Fremont County, that we'll be thinking about the addressing model. I'm hoping also that we use it in other ways throughout our practice daily. So during the training, each group, there was 3 groups of trainings that I completed. And each group, I asked them to identify different areas during a case that we could really utilize the addressing model. So other ideas and times that they came up with was treatment planning, court report writing, sending referrals to community agencies, all of those times that it's really important to not forget about culture for families. So we're also hoping to identify culture and discuss culture with each family throughout key components in case throughout the case process. So next steps. The training was eye-opening. It really helped to identify what we need to do next. So moving forward, our agency is going to be adding some training specifically surrounding LGBTQ+, ICWA, and intersectionality. These were areas that we definitely saw we need to continue to help staff grow. And then I'm also going to be modifying and tailoring the training for other staff. So staff within the Department of Human Services that are not part of the child welfare component. So our benefits side, our child support professionals, our front desk staff, we're really hoping that this can be something that will help all of us to really meet families where they are, no matter when we're meeting with them or what we're helping them with. And this is going to be an ongoing training. It's going to be a requirement for all of our staff. We're going to require that they do it annually because we really want to make sure that we maintain this piece because it's so important for the work that we do with families. MPLD Impact. So it was really hard to put all of this into words. I learned so much. Obviously, cultural competence, huge, huge, huge. Huge takeaway from I think it was day 1, day 2 of that kickoff event in October. Leadership, I learned so much. Of these lessons, it really helped me to feel empowered in my role, not only at work, but with people that I interact with. And it helped me to have this opportunity to train staff, which I never even thought I would enjoy, but I loved. The fellowship also helped me change my view on my role within the agency, and it empowered me to apply for a management position. I was recently promoted back in July of this year, so that was a huge step. And I truly believe that MPLD helped me to view myself in a leadership role. It gave me the confidence to try new things and push myself to expand my horizons. I applied for MPLD for the second cohort and I got the letter that I wasn't accepted. And I was like, oh, that's a bummer. And so then for this cohort, I wasn't even going to apply. I was like, nah, but my supervisor at the time really encouraged me to do it again. And I never, ever thought I would get selected. So I just feel like it was a true blessing. So with that, thank you, Arlene and Sharon Lynn. Thank you for teaching me to ask for help when I need it. That's something that is oftentimes hard for many of us. Thank you for reminding me just to kind of stay calm and not have to always react. That was a huge takeaway I had from Sharon Lynn. Just let it go. So I appreciate that. It's on a little sticky note on my computer. And then huge thank yous to my mentor, my agency, my director, my coworkers. I'll never forget in my initial interview for MPLD with Arlene and one of the other previous fellows, she asked, what does your support system look like? Because it's so important in this process. And I thought, oh, I've got a great support system. But I didn't realize how much I was going to need them until I really got in, the throngs of all of this. So thank you for that to everybody that helped support me, Stacy, Tony, Mick, my husband. They were all so amazing throughout this process. So thank you to everybody. And I will never forget this. And I only hope that I can be maybe a mentor in the future because I want to be part of this community forever.